Okay, I'm sitting here today with Leanne.
Deanne.
Deanne, I'm sorry. Thank you for correcting me. And Deanne, I just want to ask you a few questions about your occupation. And this won't take long. Let me ask you, have you ever been in a crisis situation at your job?
I mean, Friday night meeting.
Not really.
No?
No.
Okay. Do you enjoy your occupation?
Yes, I do.
Do you find it rewarding work?
Yes, I do.
How are you able to remain calm in the face of significant crisis?
I am a follower of the Lord Jesus Christ.
Okay, that's a good answer. All right, how do
And
you
I'm
first?
fortunate enough to work in a place that is faith-based.
Okay, good.
So everything is covered in prayer.
Okay. Well, let me ask you this. Do you first go about establishing good rapport and a sense of trust with your clients?
Most of them are not in a really good place when they first come in. They're usually going through some sort of withdrawals.
Right.
So they're not usually feeling well. So they're not really all there. So it takes time for that to develop.
All right. Well, how do you keep from being judgmental in your job?
There before the grace of God walk I.
Have you ever done drugs?
I did back in the day, but I was never an addict.
Yeah, I never pictured you that way. Okay, so have you ever had to work with the terminally ill, AIDS or cancer patients?
I have when I was doing my clinical.
You did? Mm-hmm. Okay.
I worked on a children's ward
Okay.
for oncology at Miami Children's Hospital.
Okay. Now, when you did that type of work, how did you keep such experiences from overwhelming you with grief?
The children's spirit was amazing. None of the children were grieving.
Okay.
They were happy, and it was a place that we made sure that they were kept happy, and we always were happy. And it was a contagious spirit. It was hard on the parents, and so we basically tried to make the parents comfortable and meet their needs. But the children, by and large, were very happy and went through all kinds of pain and horrible things. But they don't have a sense of future developmentally. They really don't know what future is. They can't picture it or really accept it. So for them, this is now, and they go through it.
All right, last question. Have you ever completed a psychosocial assessment for one of your clients?
I personally do not do the psychosocial evaluations. They have an APRN that comes in and does that.
Okay.
And there are therapists that do that. So I don't do the psychosocial.
But you are familiar with that?
I'm usually in the room with the APRN when he's doing the psychosocial.
Okay. And how
Biopsychosocial, huh? Super fun.
that experience there, do you enjoy that part of the job as well?
Not as much.
You don't?
No.
Why not?
Well, because I'm not actually doing the interview. I'm just kind of sitting
Sitting
there,
down.
and I'm there for the physical sense of is he prescribing medications? What is his plan medically for the patient or client? Sorry. So I'm not there to evaluate their psyche.
Right. Okay, Deanne, I want to thank you for taking the time to talk to me, and I appreciate it. I hope I got all that.